Greetings, folks. It's Friday, and it is September 11th. It's a very sobering date for everyone, although much more sobering is that year to date, this coronavirus has far exceeded our death experience during 9/11. You know, this coronavirus takes a death toll about every 3 or 4 days, as much as we experienced in 9/11. This is a very sobering piece of data. And even more sobering in that regard is that, and I have mentioned this before, is that all of the best minds, whether they're at Harvard or Georgetown or the University of Washington, IHME, COVID Act Now, all of the best minds and resources that are available to crunch the data are telling us with loud voices that we must brace ourselves for a third surge that, as many nations right now are experiencing, is worse than their first two. And that is indeed predicted for us here in the United States. The timing, now that's where we have a lot of unknown, but the timing is inevitable. And as we are currently now thinking across the nation, perhaps in the vicinity of November, I have a lot of concern about this. Our task force has a lot of concern about this. And for a lot of reasons. Do you know that this week, in the past week, we have had 4 additional staff who have tested positive? Not only is that a very sobering number, because in the last 2 weeks, that number is 7. We're not getting better, we're getting worse. And not only that, with the number of actual cases, employees that have tested positive, that is, another huge number have to be quarantined along with them. This is what has us seriously worried. Why are we having to quarantine so many people? Because what we're seeing, and we're not seeing it just in our staff, we're seeing it across our communities, almost everywhere we look, is a relaxation, or in some cases, a total uh, ignoring of the safety precautions that we all have had drilled into our heads over the last 6 months. Wash your hands, use sanitizer, wear your mask, keep your social distancing. Do not stay in a closed environment longer than 10 or 15 minutes. But yet, we see a continual, I don't know what to say, ignorance of the rule. I'm going to do something with this noise. Had to take that break. There's always some noise at my house, whether it's dogs or the phone or something. So sorry about that. Especially when I'm in the middle of talking about something very serious, as this is. Very, very serious. I know we're optimistic. I know we're seeing data that says that the number of cases overall are diminishing. Well, so is the amount of testing that's going on, significantly decreasing. Not just the offering of tests, the availability of testing out there, but the fact that people don't think they need testing anymore. So there's not a demand for it. So no wonder the number of positive cases is going down. We're in the middle of schools and universities and colleges trying to open, and many of them have opened and they've closed. This is a really tough time, and I know it. I feel it. I don't have a large family with folks that have been directly impacted by the coronavirus, although I know many of you do and have. And I know there's been some extraordinarily heartbreaking situations. Uh, as many of you would think, I have the luxury of being able to stay at home, to work at home. Although it feels like I'm working 4 times more and harder. At the same time, I know we're all facing an enormous amount of anxiety and stress. Even in my situation, I don't have kids that are going to school. I've got a stepson that is going to tech, and there are some struggles even there. I know that many of y'all are dealing with family members who, although they may not be impacted by the coronavirus, but the very fact of your familiar relationships, taking care of perhaps older parents or siblings or whomever, has become much more complicated, much more demanding, and much more stressful. The very act of going to a grocery store is much more stressful with producing anxiety. I know, I understand. I also know that I can't completely realize what you are each individually facing. The one thing I do know is that we, CARE South Carolina, is struggling with some very difficult scenarios and situations. We are having too many staff to test positive, with a consequence impacting multiples of other staff. And many times, these quarantines, or frankly, most of the time, these quarantines are the result of inappropriate behavior. Staff that have ignored our mandates to not take lunch together in small settings, offices, even our lounges. You can't be 6 feet apart and eat without a mask on safely, to be honest. I know that this is hard. I know that one of the best ways to deal with anxiety and stress is to be in community, to have your relationships, and I understand that. But I also understand that the sickness and the illness that this coronavirus and the deaths is bringing on us is nothing to be taken lightly. We are backtracking now. You know, when we first implemented some guidelines around dealing with quarantining back in April, we felt like surely everyone was going to do everything possible to avoid spreading this terrible virus. And we are in healthcare after all, and surely we were going to be able to follow guidelines, wearing masks, uh, being very attentive to social distancing, washing and sanitizing hands. And so CARE South Carolina chose to pay everyone that had to go into quarantine. And we have been doing so. It's cost us. We are one of the few organizations that I know, as a matter of fact, I don't know any other healthcare organization that is paying when their employees are in quarantine. It's cost us a little over $127,000. We've been fortunate to be able to have grants and other federal resources that can help offset that. But wouldn't it be so much better if those resources could have been directed in other manners? The bottom line is we are going to quit doing that. We simply have to make that decision. That means that effective on Monday, and you will soon be receiving this information in a written document coming out of Denise Ellis, our Chief Personnel Officer. Effective Monday, those who have to be on quarantine will not be paid by CareSouth unless they use their personal sick and vacation time. I can't tell you how I regret having to do this. For all of my time at CareSouth, I have always tried to make my decisions that remained in the best interest of you, the staff, because you are important. You are the heart of our organization. But this can't continue. When this happens, the impact of having so many staff out on quarantine could actually mean the shutting down of services, the shutting down and closing of things that would then impact our patients. It is not to you that I have to make this decision, but it is for our patients and for our community and for the well-being of CareSouth. I will repeat, effective Monday, all time in quarantine will be paid only with the individual's vacation or sick leave. We've also been very generous in allowing folks to work from home. We're going to continue with that. But we've been very good about, might I say, very creative about finding work for folks to do. I've just told my supervisors this morning, don't do that. If you don't legitimately have something for someone to do who is on quarantine, and most of the quarantine is because of behaviors that have happened due to the lack of responsibility, not social distancing, not wearing masks, not doing whatever the guidelines have been. So these have been some pretty tough decisions. There have been hard decisions, and I regret having to make them, but make them we must. I will always do everything in my power to protect the interest of you, the staff, and of the communities and patients we serve. Sometimes those are tough decisions, as this one is. But we need to get through this next period of time that is inevitably marching toward us, this next surge. And we need to protect each other, our organization, and our patients and community. We need to be mindful, and I have said this many times, that it's not just while you are in the doors of CareSouth, although a lot of the quarantining that has taken place is because of behavior that was not done correctly during work hours. But not just stop after you leave work, but continue to be mindful that whatever you do, whether you're at home or in a restaurant or whatever, unless it is safe, unless it is precautionary, unless it takes into account every one of the guidelines of social distancing, not being at lengths of time in small settings, masking, hand washing, hand sanitizing, the whole 9 yards, then worse will befall us later in the fall. Please, I am literally begging of you, do your part. Assure that your friends, your neighbors, and your coworkers do their part also. We can't be Care South Carolina strong unless we are Care South Carolina healthy. Go into your weekend with a great deal of sobering reflection on what your behavior needs to be as we continue to struggle in this pandemic. I wish you all the best. I know you're struggling with anxiety and stress. Take some time. Do the things that we talked about in the early days, breathing, taking breaks outdoors, doing some exercise, walking, bicycling, and so forth. Because, folks, we've got a ways to go. Stay healthy. I can't say stay Care South Carolina strong yet. Again, just stay healthy. We will be talking again soon next week. Bye bye.